2,000 deaths in the DRC. Why are we continuing to see this spread?
We're continuing to see this spread because the public health authorities there do not have control of this outbreak. If you look at the new cases that are occurring, most of them are coming from outside of the contact tracing environment, meaning these are undetected, unknown cases from unknown chains of transmission. So there is basically a shadow epidemic going on that's continuing to spread unchecked. And until that contact trace number gets higher, where they're able to understand who's infected, who's been exposed, we're going to continue to see spread of this virus.
Does that involve then, Dr. O'Dell, just kind of shutting off the area entirely and not allowing any free movement of people? What would that look like?
No, that doesn't involve any of that, because that could end up having a paradoxical effect and driving more transmission underground. But it does mean being much more aggressive with trying to find cases. And from what I've read, they're starting to go door to door looking for cases rather than kind of relying on contact tracing, because the contact tracing just isn't working there. So what it will mean is more people doing a lot of the basic bread and butter public health work. But the overarching point is that the community in the DRC, in these outbreak zones, has to own this outbreak. They have to become part of this response, because otherwise it can't just be people from the external world trying to stop this. The community has to be part of this response and buy into this and really see the value in stopping the spread.
This must be incredibly challenging for those health officials and health workers on the ground.
There's a lot of disruption that occurs in these provinces in the DRC where the Ebola outbreak is centered. And if the healthcare workers who are expected to take care of the patients, to do the contact tracing, to do safe burial practices, to talk to the community, if they're not getting paid, if they're not being rewarded for the work that they're doing, they're not going to do it. And it's just going to take longer and longer to extinguish this outbreak.
What about the efforts to create a vaccine that can effectively combat this outbreak?
So that's sort of a bright spot right now in this outbreak, that there are multiple clinical trials going on, clinical trials using the prior Merck vaccine, which is targeted against a different species of Ebola, which at least has anecdotal evidence that it might work. That's being tried. There are phase 1 clinical trials for specific vaccines against this particular species of Ebola, the Bundibugyo species. But I think we will start to see some data, at least on the repurposing of the Merck Zaire strain vaccine soon. But it is moving very quickly, all of the clinical trials.
How high is the risk, do you think, right now of contagion beyond the DRC?
It's clear that countries that border the outbreak zone, places like South Sudan, places like Uganda, they really have to be on alert for any imported cases that could occur. Outside of that immediate region, I think the risk is fairly low, but the immediate cross-border transmission risk is real.